Thank you. I'm going to ask again, everyone's running over, try to limit it to 5 minutes. Next is Mr. Gronfeld.
Good morning, Chairman and members of the subcommittee. Thank you for inviting me to be here today. It has been our privilege to provide services to people with intellectual and developmental disabilities in nearly every setting for more than 30 years. During that time, we've been a Medicaid paid provider and have successfully forged public-private partnerships in 37 states. We also operate Job Corps centers, have workforce and one-stop services, and provide home care to senior citizens. We're a human services company whose mission is to maximize independence for all populations who rely on us. We serve more than 65,000 people every day with more than 42,000 dedicated employees. The efforts by Congress, the administration, and the states to rebalance the long-term care system to more home and community services have led to more flexibility, individual control, desirable options, and cost-effective services. As you know, Medicaid is the only funding source for services to most individuals with disabilities. But Medicaid budgets are strapped. The demand for services is exploding, while at the same time, the available workforce is shrinking. For years, individual states have essentially been running pilot programs testing different waiver options. Currently, there are hundreds of waivers spread through 50 states. And yet, in some states, there remains significant deterrence to home and community services. States continue to fund institutional services at higher rates, offering cost reimbursement, room and board subsidies, and other incentives that are not given to waiver services. At the same time, many of the waivers have become overly complex, inflexible, and very expensive. As the cost of care rise, states have responded by limiting services, restricting eligibility, and reducing payments. Under these pressures, the waiting lists have grown along with Medicaid budgets. In services to those with disabilities, we must look at all models of care and find the few that provide the best outcomes for the most people. We must move away from models that are ineffective and costly. Refining our service models is one solution, but the greatest challenge to all services is the nation's workforce crisis. We must have a competent and caring workforce. Any discussion of changes or improvements to Medicaid policy should focus on this fundamental issue. High turnover rates, low wages, shortage of available workers, and increased demand are pervasive problems for families, individuals receiving services, and the people who provide those services. Barely 10% of the 4.3 million people with intellectual and developmental disabilities receive Medicaid services. That 10% depends on more than 874,000 caregivers. By 2020, we need nearly 1.5 million workers. That's a 37% increase in need, but there will be a corresponding decrease in the number of people available to do the jobs. Soon, we won't be able to find the people willing to care for the individuals that we serve. One solution to the workforce crisis is direct support Professional Fairness and Security Act, H.R. 1279, which was reintroduced in the 110th Congress by Representatives Lois Capps and Lee Terry. This bill, which now has 107 co-sponsors, gives states a much-needed option to secure additional federal Medicaid dollars for the workforce. This bill is an investment in a workforce that is needed to ensure the stability of home and community-based services. Congress should also consider legislation to develop incentives, such as training programs and career advancement opportunities, which would enable more people to enter this field. Such efforts should make better use of the public workforce system by getting the Department of Labor to change its guidelines for successful employment and recognize direct support professional as an accepted job classification. We also need to address our service models to more effectively use our workforce. New models of care, such as ones that use technology to provide safe, secure services with fewer caregivers, can be the answer. An example is Rest Assured, which is currently being piloted in Indiana, which is a public-private partnership between RestCare, the Wabash Center, a nonprofit organization, and Purdue University. It is a web-based telecare system that's proved to be very successful. Through this pilot, we have found that individuals who receive remote caregiving services show a greater satisfaction with the added independence they experience. Savings can be realized that would enable us to serve more people for the same amount of money. There are many people and organizations involved in providing services and supports to those with intellectual and developmental disabilities. I ask that providers be included in the search for solutions. The challenges I'm suggesting today can ensure the safety, security, and independence for those we serve, simplify the system, therefore be more cost-effective, standardize best practices, therefore provide better outcomes, and attract committed, dedicated caregivers. Thank you for your time today. I'll be happy to answer questions and provide additional information.
Thank you, Mr. Gronfeld. And now, Ms. Fortin.